Hello, everyone, and welcome to our 12 o'clock session. My name is Tina Costin. I'm one of the directors with the Office of Virtual Health at PHSA, continuing to be your host for these virtual sessions. My pleasure to welcome or re-welcome you to the 2023 BC Digital Health Forum. For anyone just joining, first time for today, joining into our virtual circle, we encourage you to share in our collective gratitude for the opportunity to come together from many traditional, ancestral, and unceded territories of BC First Nations. Let us continue to give thanks for the opportunity to gather, learn, collaborate, and provide care on these beautiful lands. I now have the pleasure of introducing our next presenter, Marianne Vidler. Marianne is an assistant professor in the Department of Obstetrics and Gynecology at UBC and a 2022 recipient of the Michael Smith Health Research BC Scholar Award. Her research focuses on developing, testing, and implementing new knowledge that will reduce the unacceptable impacts of life-threatening pregnancy and postpartum complications on mothers, newborns, and their families, as well as society. Marianne received her PhD from UBC in 2017, where she looked at knowledge, attitudes, and practices related to pre-eclampsia and obstetric care in South Asia and Sub-Saharan Africa. Wow. Please join me in welcoming Marianne on her talk entitled Fostering Diversity in Perinatal Research. Marianne, the floor is yours.
Thank you so much for that kind introduction. It's a pleasure to be here with you all and joining these sessions to talk about methods to engage diverse patient populations and as partners in research. So thank you for the kind land acknowledgement as well, Tina. But I just wanted to mention that I'm calling in today from the ancestral territories of the Great Lakes Twa, also known as Rwanda. So I just wanted to acknowledge where I'm calling in from today. Before I get started, I just want to mention that I'm presenting here on behalf of a large team that's worked together on this project, named here from a variety of disciplines and backgrounds. So acknowledging all their contribution. So to start off, a little bit about the problem that we hoped to address with this project. So as many have noted previously in their work, patient partners in research often do not reflect the diversity of their communities. And this might be in relation to education, income, race, ethnicity. So the objective of this study or this project was really to identify what the barriers are to that diversity and greater inclusion in research for patient partners, and particularly for those related to pregnancy, childbirth, and the postpartum period. With the hope, and I put in brackets, the hope that we might find some solutions or strategies to better address these challenges. So what did we do? We employed a few methods. That was an online survey. We had some virtual events, as well as focus groups and interviews. And as I mentioned, the outputs are still in process, but what we hope is to have some strategies to further guide researchers to engage diverse patient groups in perinatal research. So to start with the online survey, this was developed and distributed online to perinatal researchers and organizations throughout BC in 2022. The survey was comprised of 23 questions, and it was developed based on feedback from our virtual events, as well as a literature review and expert opinion. This was distributed by email, through social media, at our virtual events. And we found that it was successful. We were able to get 65 respondents to complete the survey. And I'll share with you some of the findings that we had, just a few kind of high level notes. So one question was, which groups are often underrepresented in perinatal research from the perspective of researchers and people involved in programs? And as you can see, for me, the take home message here is really across the board, underrepresented populations continue to be often excluded in perinatal research. With a particular emphasis being needed for Indigenous peoples, those experiencing houselessness, as well as those with invisible disabilities, but really high rates kind of across the board. We also asked what strategies are currently being used to improve recruitment and retention of some of these historically underrepresented groups, to see what is being done, maybe what has been successful, and what we could build on in the future. So some of these responses to me were encouraging. Many are providing financial compensation, which we know is important to engage a diverse group of patient partners and research participants. But we also saw that some of these categories and strategies are being used less often. And the one I highlighted here was community champions. And I'll come back to that based on what we heard in some of our focus groups and interviews. And since we're here talking about digital methods, I thought I would also pull out a couple of findings related to the methods that are used to reach populations. And these were a variety, including in-person, word of mouth, and digital. And you can see that the in-person and word of mouth were often thought to be very useful, but digital and print materials, conference and events also highly reported as at least somewhat useful and also very useful. Interestingly, there was also a number of ways that hadn't been tried by many groups, so we can't really comment on those. And diving a little further into the digital methods, we wanted to know which of those has been most successful in reaching some of these underrepresented populations. And overwhelmingly, Facebook and on other online mothers groups, as this was for a perinatal population, seem to be thought of as most useful, very useful by the largest number. And very few had tried text-based, SMS, or mobile phones for recruitment, which is also, I think, interesting, maybe a potential gap and opportunity. We also wanted to know what challenges, or what were the challenges from their perspective or from the perspective of researchers. So the most common responses were lack of time and a lack of trust with communities. A number of other things were also mentioned, as you can see, that might relate to childcare or responsibilities or other competing priorities, as well as barriers. Next, we moved to interviews and focus groups. So we conducted 3 interviews and 3 focus groups, and these were convened with perinatal populations, so either pregnant or recently postpartum individuals from various historically underrepresented groups. And they were recruited through digital methods, social media, Reach BC, as well as largely through word of mouth within communities. And the interviews were and focus groups were both conducted virtually so that we could also access people throughout the province, done on Zoom, and they were led by our student research assistants. On average, they lasted about 1 hour, and we provided an incentive for participation. The discussion guide was developed and pilot tested with our 3 patient partners as part of this project, and the data was then analyzed by the student research assistants. So we're still in the process of finalizing all of the results, but I'll give you some of the key findings that came out from the perspective of perinatal populations. So the challenges that they faced in participation included language, and this related to both appropriate language and terminology, as well as those with minority languages or not being able to access in English. The lack of diversity of research teams themselves was often a barrier or a disincentive to participate in research from some groups. This might also be related to a lack of trust, previous negative experiences, either with research or the healthcare system, that prevented them from participating, time constraints, or the burden of a participation. So this could have been time constraints, childcare responsibilities, for example, but also the heavy lift that might be required to participate in research, particularly as a patient partner. Also, some mentioned technical challenges, particularly for those in rural and remote areas, such as Wi-Fi, electricity, and the cost of internet. distance and travel time for things that were in person, and also research fatigue from some. Next, we also asked about what strategies they thought could be used to better improve engagement. And I'd say the first two that came out very strongly across all discussions were allowing sufficient time to build relationships and trust. And this included demonstrating respect for these groups. And if you think back to our online survey, these were the two biggest challenges, having sufficient time and trust. So it really just shows that that's where the emphasis needs to be on the side of the researchers. And further, to develop connections, so engage early and at all stages of research and projects, and identify champions and gatekeepers. And I mentioned this as we noted of the strategies that have been used by those that responded to our survey. Community champions were not that often reported, but this was seen to be a possible method that would improve engagement from these underrepresented populations. Again, the diverse research teams, culturally appropriate materials in the relevant languages. I say in-person versus virtual because we actually receive responses on both sides, some preferring virtual that would improve access, didn't require traveling, but also the importance of creating these relationships and a safe space in an in-person environment. Highlighting the value to the community and to demonstrate the potential benefit of participation to the individual and the greater community. And keeping materials simple, including visual aids, lay language, and avoiding over-medicalization. Finally, appropriate incentives. As we saw in the survey, incentives have become more commonplace for engaging populations in research, but these have to be the appropriate incentives for the groups that we're trying to reach. So that might be financial, but it also might be childcare, access to equipment that might be required if it's going to be a Zoom call, for example. That is all I'm going to say. I know I've left quite a bit of time for questions, but I hope that people have some that I would be happy to answer.
Amazing. Thank you, Marianne. I really appreciate not only the fact that you're joining us all the way from Rwanda. It must be later in the evening there for you, I'm sure. I'm just going to check into questions while we're waiting for people to put questions into the queue. I'd love to know what got you into this research?
Yeah, it's a great question. So we were starting a new project where we were looking to recruit people in the postpartum period. And as we had started engagement and looking for patient partners, we recognized as a group that often our patient partners look and sound similar, come from similar backgrounds. And to us, this really seemed like a disconnect between the work that we were trying to do, the people we were trying to reach and most improve healthcare and access for, and the people that were either aware or able to engage. So we thought this was, really important to put a little bit of time and effort into understanding what is it that are the barriers to this and how can we better address this, because I think this is a common theme across many areas of research. There are some things unique to perinatal populations, of course, but really across the board we see this, and how can we better address that? Yeah.
Fantastic. Thank you. Questions just come in. It speaks somewhat to what you've just spoken about, but maybe you can focus in on a few. But can you speak to how this research informs patient engagement more broadly for non-perinatal projects?
Yeah, absolutely. I think that many of the themes are similar. There are, as I said, a few things that are unique to perinatal populations, particularly related to competing priorities and timing. So, we looked a lot at what time would be best. And actually, sometimes in the middle of the night might be a good time for new moms that are up and feeding, for example, to be able to engage, or having that flexibility where that might not be the case in other groups. Another thing that's a bit unique about a perinatal population is generally we're talking about adults of a reproductive youngish age. So when we're thinking digital as well, access, familiarity, comfort with digital methods might be a little bit different than if we're talking about an older population or youth. So I do think there are some differences, but the major themes are really similar. And to me, the take-home message is it takes time. Like there's no shortcut, right?
Yeah.
I think we'd like to say, oh, you just put up an ad at this place and then you'll be able to reach people, or you know, but really what it is it takes time investing in communities, building relationships over the long term to have successful engagement. And I think that's true whatever the population and whatever the region is.
Thank you. You mentioned the element of trust being critical as much as that time factor. I'm wondering if you can speak to what that meant for the perinatal population you were working with.
Yeah, I think that's really important. I think there's a lot of history that we have to be aware of and acknowledge for many different populations, and some specific to the perinatal period. We have a bad history, of many things that have gone on around, forced sterilization, for example, and what that trauma might be held for some groups, and how that might be triggered or might prevent people from wanting to engage in research or healthcare access in the future. So I think having a knowledge of those communities, wherever you are in the world, be it Rwanda, BC, whatever, perinatal or not, having an understanding of that and being able to meet people where they're at, I think is critically important. And I think one of the first steps in being able to do that well is also gets back to one of the most practical, tangible suggestions that was received, which is actually really quite obvious, but I think we often overlook, but having diverse teams, right? Having teams that look like and sound like and have backgrounds like the people that you're wanting to engage, be it as research participants or as patient partners. And that also helps further build, I think, that trust. And I didn't mention in the slides, but we actually looked kind of at two streams. One was engaging research participants, and then one was as patient partners, because we thought there might be different barriers and solutions and things to consider. And by and large, actually, it was pretty similar. So for our analysis, we've actually just combined the two. But regardless, I think also having those diverse teams is really important in building the trust.
Wonderful. Have you got we've got a couple more questions if you have time.
Great.
So
Yeah.
we've got two, and then we can maybe let you go to bed, hopefully. So comment, thank you for your contributions around this area of health. What do you see for the future of pregnancy and postpartum support in respect to digital platforms?
Yeah, that's a great question. It's certainly what this little piece that was presented here today is hoping to inform larger digital health programs for the perinatal postpartum population. And as I mentioned, they are a bit unique by their age and their kind of demographics. I think they're really well positioned to roll out digital approaches. I think some of the concerns that we might have with children and youth, and also maybe for older populations that might be less technically literate, I think we get to avoid that to a larger extent. So I think it's really well primed for it. And I think the continuity of pregnancy and postpartum care is so important. And we know that accessing healthcare is not always available, especially in rural and remote areas, as often as people might like. Yeah. So I think that digital health can really help bridge that gap in providing reliable information, exchange, support through digital methods throughout the continuity of pregnancy and postpartum period. And we see it happening already. People are seeking it out themselves on social media, online. Yeah. So I think there's a huge opportunity and maybe a
Oh. Marianne, just letting you know, you might have frozen, we might have lost connection with you, knowing that we're reaching all the way to Rwanda, but we'll just hold for a couple more seconds to see if we can reconnect. If not, looks like she's not moving. Okay, with that, we didn't get to the last question, which was a really great one, but we will let Dr. Vidler go and rest for the rest of the evening. Thank you so much. If you can still hear us, really appreciate the time that you've had with us here today and wish you all the best. She is gone now, so we will put up the poll for feedback on this particular session. Really great insights into the perinatal and newborn population today and how digital health can create a really great community for these patients going through a pretty intensive health experience. So this is wonderful. As we wrap up, you will notice that our next session, we have a bit of a break, which is nice. Oh, there she is back. Marianne, thank you for reconnecting. No problem at all. Just really want to reiterate our thanks for being here and for sharing your research and the work that you do. Please take care of yourself in Rwanda, and those that didn't get their questions answered will reach out to you.
Thank you so much.
Take care. So sorry, everybody, I'll reiterate that we've got a next session. It doesn't start until 1 o'clock today. So we hope to see you back at 1 on a session entitled A Learner-Centered Approach to Orientation for Remote Patient Monitoring Staff. Again, you should know how to navigate there by now. Please enjoy your break, and we will see you at 1 o'clock. See you soon.